This is part 5 of the chapter 6 lecture notes, and it should be the last of it. We were talking about the components of a synovial joint or a diarthrosis, which is freely movable. And this is going to be like a knee joint or a shoulder joint or an elbow joint. You're going to have articular cartilage lining the ends of the bones, a joint capsule that will surround the entire joint composed of the two bones normally, and then synovial fluid, which reduces friction within the joint. Okay. Sometimes, like in the knee joint, you're going to have additional structures. The meniscus, which is here's an example of a meniscus, is an additional pad of fibrocartilage that helps provide a little bit more structure to the joint. Sometimes you'll see fat pads, like here, kind of below the kneecap. Bursa are packets of connective tissue containing synovial fluid. Sometimes you'll have bursitis. Here's a bursa in front of the kneecap, and then there's a bursa between the patellar ligament and the tibia right here. And those are going to reduce friction and absorb shock, but they can be very painful if you get any inflammation in them. It's called bursitis. You're going to see ligaments which join bone to bone. In the knee, there are the anterior cruciate ligaments and the posterior cruciate ligaments. There are tendons. The quadriceps tendon actually and the patellar ligament are continuous with one another. The quadriceps tendon connects the quadriceps muscles to the patella, the kneecap, and then the patellar ligament, which is just a continuation of that quadriceps tendon, connects the patella or the kneecap to the tibia. Name and describe the three types of joints as classified by their range of motion. We had the synarthrosis, no movement, the amphiarthrosis, which is some movement, and the diarthrosis, which is freely movable. In a newborn, the large bones of the skull are joined by fibrous connective tissue, but later form immovable joints. Structurally, which type of joints are these? They're called sutures. They are fibrous joints, and they are in the class of synarthrosis joints because they have no movement. These are some types of movements. There's the plane or gliding movements where two surfaces slide past each other, for example, between the carpal bones. Then there's flexion and extension, which is what you do when you have your arm completely straight, you're extending it. And then when you bend at the elbow, that's flexion. And hyperextension is when you extend beyond the anatomical position. So hyperextension at the elbow would cause damage, but it would be basically when your forearm would move back toward your back. And instead of your arm moving to where your forearm is moving toward your upper arm, it would be moving in the opposite direction. Okay, so abduction and adduction are movements away from the midline, and you can do this with your fingers, you can do it with your arms or your legs, but adduction is when you move your arm back toward your body. Abduction is when you move it away from your body. Circumduction is when you draw a circle with your arm or your leg. Rotation is when you turn around the longitudinal axis of the limb. So turning your head left or right, like shaking it yes and shaking it no, is rotation. And then pronation is when you take and put your palm down, and supination is when you move your palm up. Inversion and eversion is when you twist the sole of your foot. It's a little bit hard to do. You kind of have to look at a picture to see that. Dorsiflexion and plantar flexion. So plantar flexion is when you're standing on your tiptoes, and dorsiflexion is when you are standing on your heels. Opposition and reposition is with the thumb only, and that's when it's opposition, it's when the thumb is touching any of the fingers, like the pinky is opposition, and then reposition is when the thumb returns to its normal position. Elevation and depression you can do with your mouth. If you open your mouth, that's depression. If you close your mouth, it's elevation, because we're talking about your jaw, okay? When you shrug your shoulders, that's elevation, and when your shoulders are normal, that's depression. When you bend to the side, it's lateral flexion. Now, types of synovial joints, there are plane or gliding joints, there are hinge joints. So the knee and the elbow would be hinge joints. Between your phalanges are hinge joints. Saddle joints permit angular movement in two planes. The joint between the thumb, the carpal, metacarpal joint of the thumb, so that's like where the thumb connects to the wrist, is a saddle joint. And then between the sternum and the clavicle is a saddle joint. Pivot joints permit rotation in one plane, so like the atlas and the axis, and the ulna and the radius. There are condylar joints, ball and socket joints like the hip and the shoulder joints. Give the proper term for each of the following types of motion. Moving the humerus away from the longitudinal axis of the body is abduction, A-B-D-U-C-T-I-O-N, abduction. Turning the palms so they face forward is pronation. Bending the elbow is flexion. Which movements are associated with hinge joints? We just went through all of them. So, let's see. We talked about symphysial joints, or joints between the intervertebral disc. Also, the pubic symphysis. The shoulder joint has the greatest range of motion of any joint. But the greater the range of motion, the sacrifice is stability. So you have a lot more dislocations at the shoulder joint. It is a ball and socket joint. It has several bursa to reduce friction, and the muscles that surround and move the shoulder joint form the rotator cuff, which in Chapter 7, you'll have to know the muscles that form the rotator cuff muscles. The elbow joint is a hinge joint. The hip joint is another ball and socket joint, but it's a lot more stable than the shoulder joint. So it allows for the same types of movements, but just not as freely movable. For example, I mean, you can do circumduction with your hip. You can take your tiptoe and draw a circle on the floor, but you can do that a lot better with your arm. You can draw a circle with your hand and your fingers and your shoulder joint a lot easier than you can your hip joint. You can also rotate your shoulder joint a lot easier than you can rotate your hip joint. The knee joint is special because it needs a lot more stability than a lot of joints. There's a lot of pressure that comes down on the knee, so there are lots of knee damage. The knee has these special fibrocartilage pads called the medial and lateral menisci that help provide a little bit more stability. There is the quadriceps tendon, which attaches the quadriceps muscles to the patella, and the patellar ligament, which comes down the front of the knee and connects the kneecap with the tibia. And then you have the tibial collateral ligament, which is kind of along the outside, the lateral edges, and the fibular collateral ligaments. So the fibula, the fibular collateral ligament attaches the fibula attaches to the fibula, and then the tibial attaches to the tibia, attaches the fibula to the femur and the tibia to the femur. And then we have the ligaments on the inside of the kneecap for extra stability, and they are called the cruciate ligaments because they make a cross. There's the anterior cruciate ligament and then the posterior cruciate ligament. These are damaged a lot in sports. Would a tennis player or a jogger be more likely to develop inflammation of the subdeltoid bursa? A tennis player, because the tennis player uses their shoulders more. And then Daphne falls on her hands with her elbows slightly flexed. After the fall, she can't move her left arm at the elbow. If a fracture exists, which bone is most likely broken? That one is probably, I should have looked this one up. I'm sorry. I will, and I'll come back to it. Why is a complete dislocation of the knee joint an infrequent event? And that is because of so many different ligaments that are designed in different, the menisci and the ligaments and all of that are designed to make it more stable. Okay, going back to the question about Daphne, if she falls, which bone she falls, and oh gosh, let's read it and then come back to it. Okay, Daphne falls on her hands with her elbows slightly flexed. After the fall, she can't move her left arm at the elbow. If a fracture exists, which bone is most likely broken? So if we come back up here to the elbow joint, it is this bone right here, which is the ulna. This is the bone that's most likely broken if she falls that way, the ulna.